I've always been a tinkerer. Even as a kid, I would take things apart and just try to rebuild things. I had an old Honda in my parents' garage, and my father came home one day and the whole car was in pieces. He thought I would never get it back together, but actually I did get it back together and drove it back to college. Surgeons like to work with their hands and fix things. Looking back, it all makes sense that this is where I'd be. I'm Heung Bae Kim. I'm the director of the Pediatric Transplant Center at Boston Children's Hospital. I tell our transplant patients that they are becoming part of our family. It's a lifelong commitment when you get an organ transplant. And so no matter what happens, we're with them. We were operating right next to the pancreas, so I'm not surprised that those numbers are a little elevated, and that can also cause a little bit of discomfort. One of the things that the patients like about our center is the patient-centered care. They see it from the moment they walk in the door. This is a pediatric-friendly hospital. There are a lot of differences between pediatric and adult transplantation, including how you do the surgeries, medical care, even simple things like dosing medications. The long-term care is quite different too. We have things at Boston Children's that a lot of centers don't have, including things like child life, back-to-school programs to get kids back to their normal routines. We view growth and development as being just as important as doing the transplant surgery. If we transplant a patient but we don't get them back to their normal lives, we actually kind of view that as a failure. JP. Yeah. This is just a great place to work. I like the fact that everyone really has the same goal in mind, taking care of the patients. I actually can't imagine a better environment to work in than Boston Children's. It's about 10 days after transplant and everything's going pretty well. He's a star. Doing great. High five. Oh, careful.